You are welcome to today's session of Wellness Wednesday. Before we actually start, I wonder whether we have any guests in the house. You're a very special set of people. If you're a guest, please indicate in the chat box and tell us who invited you. Oh, yeah, it's raining here in New York. Yes, thank you. Do we have any guests here? If you're not yet a part of the green community or this is your first time, we'd love to welcome you. So, but while we wait for our guests to indicate, we'll go ahead and start. So good evening, everyone. My name is Dr. Fumi Aino, and it's my privilege to be the host of Wellness Wednesday as well as the speaker. Wellness Wednesday is a program brought to us courtesy the Green Mondays. The Green Mondays is an entrepreneurial platform where we build wellness and wealth partners globally. And I'm a four-star manager and a stock trade partner with the company. And today we're going to talk about a very important topic: unexplained infertility. You know, this condition, I mean, what made me decide to talk about this is it's a very common condition, and statistics say that about 1 in 8 couples are affected. I believe it's important to talk about it because many people are impacted one way or the other. Either a couple find themselves in that situation, or maybe you know somebody, or you know somebody who knows somebody who has this condition. And so it's important for us to have information so that people can be directed to the right place and they can be put in the right direction of a solution. And that's what this class has been put on. Actually, the topic of infertility is very, very wide. It's wide. It will take hours and hours to talk about infertility. And so today we'll be focusing on one aspect called unexplained infertility. And it's my hope that everyone who's here or who's going to listen to this later will have some information with which they can help themselves or help somebody they know to move in the direction of a solution. So what is infertility? You know, infertility is the inability of a woman to get pregnant after 12 months of regular and unprotected sex. 12 months unprotected sex. But if the woman is above 35 years, the definition goes into play after 6 months of regular unprotected sex. So a couple who is older, where the woman is older than 35 years, after 6 months, they're said to be infertile. This is because, fertility starts dropping from the age of 35. And so I believe it's prudent for a couple with an older woman to start treatment or investigations or treatment earlier than a younger woman. And we have two different types of infertility. We have primary infertility, in which case the woman has never been pregnant before. And then we have secondary infertility. There's been at least one prior pregnancy achieved. So if a woman had gotten pregnant, had a child, or didn't have a child, but got pregnant, and then she has a relationship, she's married, and then she cannot conceive after 12 months, she's said to have secondary infertility. And so if you are following me, please type primary or secondary. Let me know that I'm not alone here. Primary or secondary. So I'll wait for us to type that, for those of us to type that, primary or secondary, if you're following me. Thank you. Thank you very much, Mr. Gulesi. So what causes infertility? You know, there are actually a number of causes, but in broad terms, when a couple has a challenge conceiving, the challenge problem is either with the male, with the female, with both, or with none. So those are four broad situations. But what actually causes infertility? Age, especially with women. As a woman gets older, her chances of conception are low, especially after the age of 35. With men, after the age of 40, there's a slight decrease in the fertility, but it's more pronounced with the woman. Then we have ovulation problems, and there can be different problems. So we've just put it in broad terms. Like I said, the topic is a very wide one. Then we can have fallopian tube problems. Those are mechanical problems. I believe you can see my screen, yeah, and you can see the female reproductive system and the male reproductive system. So if you look at my cursor now, for a woman to have a couple to successfully achieve a pregnancy, the sperm goes in here, into the vagina, through the cervix, into the uterus. Then the egg, when the egg is released from the ovary, it passes down the fallopian tube, and somewhere here, the egg and the sperm meet. And then the conception takes place, and then it travels down to be implanted somewhere here. So now anything that can cause that process, that can disrupt that process, can cause infertility. So we have uterine problems as well, maybe like fibroids, abnormal uterus, and all those. That when we talk about fallopian tube problems, there could be blockage, that it could be damaged, such that the movement would not be smooth. Then the egg, the problem, the male, the sperm count could be low, the sperm motility could be low, there could be abnormal sperms. And then we also have unexplained infertility, which is the actual title of today's class. Now, before a couple can be said to have unexplained infertility, standard investigations would have to have been done. And so let's look at these. In the man would normally be asked to do a seminal analysis where the sperm count would be checked, the motility, the morphology, that is whether it's normal, whether they're normal or not. They might do a culture to check whether there's any infection. Then male reproductive hormones could be checked. And then if there's a challenge, an ultrasound scan of the scrotum. That's male. Do we have somebody that needs to mute? So with the woman, a hormone assay where the female reproductive hormones are checked, prolactin, progesterone, what we call FSH and LH, and then the thyroid function test. Then another test, which I don't believe is always routinely done, but in some places it is, a test for ovarian reserve. And it's called AMH. It's the anti-Mullerian hormone. So it shows how many eggs the woman still has.
Okay.
So the hormone assay, and then a hysterosalpingogram, which is called an HSG. Sorry, this is an error. It should be HSG, hysterosalpingogram, and that's an X-ray of the womb with the tubes, and a dye is usually what we call a contrast medium is passed through, and the examiner will be able to see, whether the tubes are open, whether they spill out freely, whether there are any abnormalities in the uterus, and then a laparoscopy. So when all these tests have been done, and if nothing is found, usually they would find something either with the man or the woman. But in a certain percentage of people, of couples, nothing will be found. These tests will turn out normal. We're said to the couple is diagnosed as having unexplained infertility. So if you're following me, please type unexplained. Unexplained. If you're following me, type unexplained. Thank you. So like it says here, diagnosis given to couples who have been trying to conceive for at least 12 months of regular unprotected sex without success and have no identifiable cause for their fertility after conducting standard tests. And this affects regularly 10 to 15% of couples, but some sources say up to 30% of couples who are trying to have a baby are affected by unexplained infertility. Now, what are the causes of unexplained infertility? Basically, they say a cause has not been found. Actually, maybe the cause has not been found. Maybe they've not looked deep enough, possibly. So there are likely to be a number of causes of this condition. Any minor issues in any of the reproductive organs that are not detectable. So, let me go back to this slide. Imagine maybe there's the tubes are actually open, but there are some things called fimbria, which help in moving the egg, and those are not working properly. It can cause infertility. Maybe the quality of the eggs, the woman may ovulate, but the quality of the egg may not be optimal, and so it will reduce the chances of the woman getting pregnant. So there are many possible causes. Age, again. Age has to also do with the quality of the eggs, the ovarian reserve. There can be some genetic factors that can make ovulation a challenge. There are immunological factors. So for instance, there can be autoimmune reactions against the sperm or the eggs. There's a condition called endometriosis, where the uterine lining tissue shows up in other places outside the uterus, and that can also cause infertility. Now, it's a known cause of infertility, but if it's very mild, such that it's not really detected, it can also cause unexplained infertility. So meaning the cause has not been found. Then we can have some infections. Maybe a woman has had, or a man, they have infection, and they they can't conceive because of that. Maybe the infection has been treated but not properly treated or something. It would come up as unexplained infertility. Before I go further, I want to ask, is Dr. Rex in the house? If Dr. Rex is in the house, please. Okay, you're in the house. Thank you. We'll soon call on you. So, yeah, what are the options? You know, it can be frustrating when when a couple has been trying to conceive and then tests are done and they say nothing is wrong. You know, that can be frustrating. But what are the treatment options? Now, there's some of these things that are normally done if you see a doctor or a gynecologist and the couple has unexplained infertility. They may use certain medications to induce ovulation. So even though the woman is already ovulating, but maybe those increase the chances of ovulation. Intrauterine insemination, where the sperm is taken and it's put into the uterus past the hostile cervical mucus, hoping that maybe the problem was that there was some reaction between the mucus and the sperm such that the sperm couldn't pass through. So intrauterine insemination. And then IVF. I'm sure we all know about IVF. In vitro fertilization, also an option. It carries the highest success rate, but also it's the most invasive and the most expensive of these treatment options. Then we have natural and lifestyle options. So a couple who has unexplained infertility or has infertility generally would be encouraged to have a healthy diet, eat a balanced diet, cut back on caffeine, engage in regular exercise. Also to keep your weight, the couple should keep their weight healthy, because being overweight can also cause infertility. Underweight as well. If a woman is underweight, it can cause infertility in terms of it can disrupt the hormonal system. Then the couple will be asked to quit smoking, reduce alcohol. I forgot to put that there. Reduce, because excessive consumption of alcohol can also play a part in infertility. Then basically the couple should reduce overall stress. Anything that causes stress, maybe take a holiday, reduce stress. And then antioxidants. Now for me, this is interesting because I have a theory, that antioxidants, that oxidative stress could be at the root of some of the cases of unexplained infertility. And I did some research and it did turn up something that, some limited studies showed that there may actually be an oxidative stress component in some cases of unexplained infertility. And in some of them, antioxidants were given and there was slight improvement in the rate of conception. Now, when I talk about antioxidants, this brings me to the Green Mondays. Like I said, this meeting is brought to us courtesy the Green Mondays. And what really is the Green Mondays? The Green Mondays is an entrepreneurial platform. We create wealth and wellness partners globally. Like I said, we're about health, wellness, and wealth. And we have a range of products, a range of natural products, natural herbal supplements that are safe They're safe, they're made of the highest quality, and they've been proven to be effective. And they were approved by NAFDAC. They have FDA approval for sale in the US. They have been researched. And the ISO standard, ISO is a global body, global standards body that it's like calling an external auditor to come and audit your factory. And that is what was done. And the company, Marvel Natural Products Limited, that produces the Reader range of products, was given certification. Then we had, before the products came on the market, there were preclinical and toxicity trials, preclinical trials and toxicity tests. And then after they came on the market, there was a clinical trial, and that with the results, came out positive that for what it was tested for. So it was tested on diabetes, hypertension, and arthritis. And it showed statistic evidence that Reader does help. Now we're now building a community of users who share their testimonies. And before I call Dr. Erect, I will just talk about the products. We have a whole range of products. We have the bitters. We have the Restore for Women, which helps the reproductive system of the woman. We have Fire for Men, which also helps, promotes reproductive health of the man, among other things. We have the Fat Burner. So even if a couple is overweight, they have what they can use. And then we have the Cleanser, which is for infections, it detoxifies and cleanses. Now, why do these products work? Contains herbs that have been used over thousands of years, and they have different properties. But one of the properties they have is antioxidants, which help to mop up the oxidative stress, which is happening to everyone. Oxidative stress is a phenomenon whereby the free radicals produced during normal chemical and physiological reactions, they go into the cells, they can damage the cells. But antioxidants in the body, they counter the cells. But when we're exposed to certain environmental and lifestyle conditions, the free radicals are too many for the antioxidants to counter. And there we have oxidative stress. And we have so many testimonials. And at this point, I have a colleague in the house, Dr. Susan Erekosima, aka Dr. Erek, who has, I won't even say what she has or has done. I'll allow her to share. And so Dr. Erek, please unmute. I think let me stop sharing so that you can unmute.
Good evening, Dr. Funmi Ainos. Good to see you again.
Good evening.
And good evening, everybody. I'm very pleased to be here once again. And thank you, Dr. Funmi, for bringing me back on board. I'll just take a cue from where you were rounding off from before calling me. And the role fertility stress plays in unexplained fertility. Please, I hope everybody can hear me. If you can hear me, just
now that we can hear you. We didn't hear your first sentence.
Oh, sorry. I said that I was going to take a cue from where you were rounding off from oxidative stress and the role that it plays in unexplained infertility.
Thank you. Yes.
Okay. So what oxidative stress does to infertility is that it makes a mess of the hormonal balance. Now, the hormonal imbalance is one of the leading causes of infertility. Most of the time, when a hormonal profile is done, for women mostly, which is commonly done in Africa or Nigeria, even though it's supposed to be hormonal profile for female, please, can you still hear me?
You went off a bit. We heard hormonal profile for female.
Okay. So I was saying that it's supposed to be hormonal profile for male and hormonal profile for female. So, but most commonly in Nigeria, when a woman is unable to achieve pregnancy after a certain time, it is termed that the woman is the problem. But the leading research presently, 65% of men are the ones with the infertility cases. So it is imminent for us to have hormonal profile for male and hormonal profile for female. So when you do a hormonal profile, it tends mostly to tell you about which of the hormones is not balanced. So most of the time, you will see one hormone is slightly higher than the other, one other hormone is slightly lower than the other. So in this case, it brings about a lot of imbalance, which does not allow for fertility to take place. Now, in some other cases, you do a hormonal profile and everything is looking fine. Nothing is wrong. The doctor said nothing is wrong. So what is the problem? We do not have enough rest in Nigeria, like you were mentioning, Dr. Fumi. We do not sleep enough. We consume alcohol a lot. We engage in smoking. We eat most of the food that causes obesity. We eat very late. And of course, anxiety. Most of the people trying to take in are super anxious, super worried. Anxiety, worry will just mess up the whole hormones. And that one you will not see in your hormonal profile results. And that's why you do a hormonal profile test and it says nothing is wrong, but you are worrying that you have not had a baby yet. Please, if you can still hear me, help me put a smiley in the chat box. So in this situation, that is where our antioxidants come in, and that's where I'm going to be taking my testimonies from. Now, we've had several clients whom we have had their tests done. The semen count is okay. The female test is okay. But what is going on? Oh, doctor, I'm even resting well. I'm no more worried. I'm no more anxious. But I cannot seem to find out what the problem is. Now, so we did it. We did some test runs and we said, okay, you know what? Let us take away those free radicals that are causing the trouble, the ones that we may not physically see. And then when you ask some of them, they say, oh, I come back at 8 p.m. I work in Lagos, I work on the island, I work on the mainland. I have to get back home late, so I eat late. So say, okay, let's help you burn up those troubles that would cause, that could be responsible for the infertility. And so we did some trials. For those with the overweight, we put them on the fat burner to bring down the weight. Those that are saying, oh, nothing much, I'm just having some itching, some discharge, some foul odor smell, and all of that. We now give you the cleanser to keep them off. And then after those two have been established, the weight is fine, the infection is taken care of, then we'll bring in our super supportive agent of the female restore and the male reedifier. Now, these two agents, when used together, now when I say when used together, the woman is taking hers and the man is also taking his, have come out with awesome results, ranging from increase in semen count to more and improved erection and sustained erection, better sperm production, and the woman having her eggs coming out more, because you realize that What the restore does is it relaxes the hormones. Once the hormones are back to its relaxing base, you realize that the woman tends to produce more eggs. So when these women come back and say, oh, doctor, I feel I should repeat my hormonal profile results, because I like them to do tests before you start and after you have taken. And then I give you a stretch of, you have to take for 3 months, because that's what we have seen in our trial cases. And after 3 months, repeat the test, you realize that we have had skyrocketed improved results. And in most of the time, for most of the cases, when they are coming back for the hormonal profile test, I'm always insistent that we must have a pregnancy test done. And we are realizing that the pregnancy is just right at the corner. And in so many of the cases, just before the 3 months is completed. And some other men will tell you, oh, Dr. S, look, I've not been having a good erection. Well, I've not been having a good sustained erection. I'm not having good production of sperm. The sperm is always looking watery and all of that. I will say, okay, give it a shot and give us a feedback after 1 month of usage. In fact, by the time we are attaining 1 month, you already tell you that this thing is firing too much, meaning that we are having better and improved results. And then some of them will say, doctor, please, I want to sell your drug back to you. And I'm like, why? My wife is already pregnant. Awesome. We have had several recorded results. I've had patients who have had to have twins. We've had patients who have had triplets. These triplets, the first one was gotten after an IVF implantation. However, before the IVF implantation, they had already made up their minds that they were not just going to do the IVF. And I asked why. The husband said he was not comfortable doing an IVF because he had a 0 sperm count and he did not want to use a donor sperm. And I said, okay, you know what? Come aboard. You don't want to use a donor sperm count. Let's give this a shot. The clinical trial says 3 months, but I will want you, if you can be patient enough for us to push it for 6 months, because you are coming from 0, not low. And so we pushed. So as at the 5th month, because the IVF consultants were ensuring that they were having his sperm counts, running up every month. And in fact, kudos to Dr. Chinoye. I'll mention her IVF center later, not in this session. And so by the 5th month, she just called and said, doctor, look, I need to send you this your patient's results. I said, oh, what's up? So she just gave me a feedback of the previous 5 months. And as at the 5th month, she was saying, Dr. Rex, I think we can go ahead and use his semen. I said, no, just wait. Let's complete the 6-month shot. She said, no, I think it is. Something can make it go down now. I said, no, he's been doing what he's doing. Let's keep at it. As long, she said, can we increase it? I said, no, he's been on two capsules Noctil. Let's just keep at it. And, I just told him, okay, if it's possible, just stay off any form of stress and let's just do what we are doing. And I can tell you now that we have that client, they've had their babies already anyway. They've delivered their baby, their babies, and it was his own sperm that was donated, not a donor sperm. So you see, we've to up. We've also come from building from, not having sustained erection to having sustained erection. And in so many cases, the males have infections and they did not know that they were having infections. As a matter of fact, the urine culture results and the seminal fluid analysis results did not pick up anything on their results. These are culture tests that I've had to do myself. I've had to look under the microscope myself. Whereas there were complaints that were indicating that, look, this person will have an infection. And that's one of the very interesting things that comes with a man's prostate. When a man is attaining the age of 40, the prostate tends to enlarge. So for most men, because there's nothing really, really, really disturbing them, they don't see it as a biggie. But for some of them, they are observant. They're observant to see that their erection is not sustained, or when they are urinating, they realize that there's semen coming out with the urine, or they just stay and just start having seminal fluid discharge, or some parts of itching, or there's just this bulge around their scrotum, or some lower abdominal pain or severe back pain. And then when we realize these signs, even though the results are saying no, we bring in our reader fire and we'll say, okay, you know what? Something is definitely up with you. Let's bring in the antioxidant. And by the time they are taking it about the first, even to before they enter the second month midway, you have realized that all the symptoms are gone and they are having better, improved sexualities. So if we sit here today, I'll be able to show you so many testimonies. But what I want to assure everyone here in this class today is this. The reader antioxidants is the best that I have worked with. Trust me when I say I have used several antioxidants, ranging from up to down, this and that, so many names. I have few of my patients that are in this meeting, so they are here, they can testify, and they know how many I've had to use for them before we had to use the reader antioxidant. In fact, one of them here today is pregnant and she's in this meeting, and it was a good one. Her own case was very peculiar because she has had 2 previous miscarriages, and each time she keeps having the miscarriage, she keeps wondering, but I've gone for tests and everything seems fine. The one that was not balanced, I've taken medication and everything was corrected. Dr. X, what's the problem? I said, okay, you know what? Let's go to read that restore. And she said, Dr. Rex, herbal medications, this and that. I said, this is me. You know me. I will not use something for you that is not working. Let's give it a shot. So she said, okay, she'll talk to her husband about it, and she went quiet. So when she went quiet, I knew that the husband was not receptive, so I kept calm. But about a month or 2 later, she chatted me up and said, look, Dr. Rex, after I had my last miscarriage and the evacuation was done, I'm here to see my cycle. I've done pregnancy tests, I've done scan, and everything seems fine. And I told her, are you ready for me now? And so we started Restore. And by the time she was almost done with the second bottle, she said, doctor, I saw my menses this month. I said, awesome. Okay, continue till you tell me that my menses has lost again and is a positive pregnancy test. And in fact, I had even forgotten about her case until she just walked up to me and said, I need to see you in the hospital. I said, I need to see you. I said, you're coming from far. Tell me what she said. No, it's something we must see physically. And she came out giving me her pregnancy test results. She's about, I think, 13 weeks now, almost 13 weeks now. And she's right here. I know she will not want to identify for so many reasons, which is fine. But these are evidences that we have had, we have tested, and we have proven. So when you come to us, don't just say, I want the Restore and the Fire. No. We may not likely start with the Restore and the Fire first. We would like to take a history. We would like to ask you questions so that when there is a need for us to bring in the cleansers, for some of us, we will need to start on the Restore and Fire straight for the husband or the wife. For some, in most cases, many, we will need to give you the cleanser first because we need to detoxify all the things that have been giving us challenges or that are waiting to pose trouble. We'll get rid of them. Once we get rid of them with the cleanser and the bitters, awesome. Then we check your weight. If your weight is overboard, we will need to tell you we need to give you the fat burner to bring it down. But if your weight is just fine, then we are ready for you for the Restore and the Fire. Then for those that are underweight, like Dr. Fumi was mentioning earlier, we would give you the proper, multivitamins to help boost your weight up, because underweight too is a major concern for infertility. Then, of course, those who are hypertensive and diabetic, because hypertension and diabetes too are troubles that can cause infertility. So for those people, we will need to keep you on the cleanser and the bitters to make sure that your sugar level and your blood pressure are under good control before we can now bring you on board the Restore and the Fire. So don't say, because it talked about Restore for men, for women, and the Fire for men. Let me start that first. No, get the counsel. Talk to us about what is going on, and we'll give you a right. And then I want to let you know that you will definitely come back with your own testimonies of babies. We have tested it, we trust it, we have seen testimonies, and you are the next to testify by the special grace of our Maker. Thank you very much, Dr. Fumi. Let me hand it over to you from here, ma.
Thank you so much, Dr. Rex. Thank you for coming on, and thank you for sharing with us. I know that this is just a tip of the iceberg of what you could have shared with us, but we would not have left here, if you continued. There's some questions, but I think we will take them at the end. Somebody is asking, is it possible to be pregnant and still have menstruate? I think it's possible in a few people. It can happen. It can happen. So I am going to continue. So thank you. Like I said, testimonies abound. And there's something, I want to say. It's very important to know why a couple is infertile. It's important to have investigations. I know why I'm saying this, because there are some people who they're taking medications, they've done a scan, but they've not done all the tests. In fact, I had a consultation with a lady today, and she's had it's secondary infertility though. But as of today, she's been trying for another baby for like 7 years, but she has not yet had an HSG. So we don't even know if her tubes are patent, if there's free peritoneal spill. So it's very important to be investigated so that we know what kind of infertility is being treated. So thank you so much once again. So now we've talked about the use of the reader range in infertile couples. And these are shown by Dr. Rex and by so many other testimonies that I know many of us here have. But who else needs our products? People who want to prevent disease. Some people are presumed normal, but the free radicals are accumulating, and it's just a matter of time before the oxidative stress starts to cause chronic disease. Then some people want a better lifestyle. Some people are on medications, and the side effects themselves are even damaging their lifestyle. So the reader range of products, especially the bitters, helps with a better lifestyle. Then with people who are managing hypertension, diabetes, or arthritis, reader has been shown scientifically to help with the management of these conditions. Another person who wants to build your immunity. We all need to build our immunity. Our immunity can be improved with our diet. But how many of us keep to the type of diet we're supposed to take? How many of us today has had 5 portions of fruits and vegetables today? If there's anybody in the room, if you have had 5 portions of fruits and vegetables today, please type 5. If you have had 1, please type 1. If you have had 2, as we go along, please type the number of portions of fruits or vegetables you have had today. So to build our immunity, we need something like reader to help us along. People want to stay fresh, stay fresh and young looking. Then people who have children and want first aid for most issues. Now, I would change this and say anybody who wants first aid for most issues, because reader is a must-have. Reader can arrest bleeding. Sometimes, I don't know whether it's happened to any of us, sometimes in the night, something happens, it's a non-specific condition, maybe it's 2 a.m., you can't get to the hospital, and you need something to take. There have been a number of people that have taken reader, and whatever was wrong, which they didn't know, was resolved. So reader is also good for first aid. So in fact, everybody, every home in the world needs to have a bottle or two of reader. And so, what are the benefits? I mean, you're here today and you've heard this, you want to take the product. Yes, take the product, but apart from taking the product, you can even benefit from sharing the product with your family and friends. You know, you take something and it's of value. Really, when we think about that, it's not fair for us to have these, to know that this can help someone and keep quiet. But you know what? The company rewards you from, if you come on board as a distributor, as a member, and you refer people to buy our products, you earn when you refer people. And then when those people in turn refer people, up to 12 generations, depending on which level, which package you came in with, whether it's bronze or VIP. And then you earn as you buy products, as you use our products, and you buy monthly, and the people you introduce use and buy monthly, you attain certain ranks, certain achievement ranks. And when you get to those ranks, you earn as well. Then there are 3 compensation plans. If you come as a member, there are 3 compensation plans that you can earn from: the matrix, the binary, and from the uni level. But you know, apart from the reader, for somebody who would like to uh, drive this business, it's the benefits are that you can do it from home. And if you're already working, but you're using it as a side hustle, you can do it from home, from the comfort of your phone. You can build a business with low capital, earn big. You don't need anything else apart from your phone and your data, and you can earn actively and passively. At a time like this in our country, extra income is not just a nice to have. I believe it is essential. But if you think that extra income is essential at this time, please type essential so that I know you're following me. And then another benefit is that you will be part of a wellness and wealth movement. Now, just to look at the different compensation plans which you can earn on, the matrix, which actually is, yes, is very essential, which actually is our loyalty plan, helping lives. You can earn, potentially you can earn a few millions over and over again. With the binary, you can earn multiple millions, and with the uni level, the potential is in billions. And this table gives a pictorial, a tabular evidence of what is possible. And if you look, you can see the millions and the billions. This depends on you, how you want to take it, how you want to drive. The number of people that you directly or indirectly add value to their lives will determine how far you go in terms of income. So even as we draw this to a close, what can we do from here? We've heard about unexplained infertility. We've heard what causes it. We've heard what we need to do if we know somebody or a couple who are affected by this. We know what to advise them in the right direction. One of the things you can do is to use the reader range of products. You can talk to one of the medical personnel in the team, in the company, to guide you on how to use it. You can see from what Dr. Rex said, it's not necessarily that you just give reader, restore, and fire. No, it depends. We have to take a history and know exactly how to go about it. I know that a number of us do contact me as well, and I'm happy to give that support. So sign up and get started. Even if you're here and you want to just use the products, you can sign up because you'll get them at a cheaper rate. And when they give you value, you will share with other people. Then promote the products and the opportunity. make your monthly purchase, and duplicate yourself in a team, and you're well on your way to not only achieving health, but also achieving wealth. And how does this happen? You can come on board. To be a full member of the Green Mondays, you need a minimum of a bronze pack, which is 25 or actually 30,000 naira. It could be bronze pack, silver. Silver is the most advantageous, and or gold or platinum or VIP. Anywhere, wherever you find yourself, you can start. You can also even start from our loyalty program, which is called Helping Lives. So as we wrap up today's session, there are two options. You can go to the left or you can go to the right. To the right is Green Mondays, depending on your pocket realities at this time. Start with 30,000 naira and above and have billions in potential, depending on how you drive. You can have, there are no limitations because you have access to all the products. If honestly all you have is 7,500 naira, or maybe you just feel, okay, excuse me, I'm not yet ready to commit, you can start by coming on board, Helping Lives, and still share with family and friends, and you have an income potential of 6 million a few times. Again, it depends on you, depends on what you do with that registration. The limitation here is that you have the bitters only. Now, thank you all for listening. We have come to the end of tonight's Wellness Wednesday, bang on time. Thank you for listening. We have 1 minute to take a couple of questions so that we can wrap up. Thank you.
Hello.
Yes. Hello.
Yes, my name is Taiwo Oyewole. My question goes like this.
Okay.
Can we have the recording of this wonderful lecture now so that I can share with family and friends who also need the product and who are also in this condition we just talked about?
Yeah, the recording will come out. I think